training.
Or has
She's
he been?
working.
She
doesn't need
well, the
training.
bending on your stomach is a little bit more intense. Okay.
She's gonna take a little.
Do you want to practice one of each one?
Sure.
So I'm just gonna do
What's your shoulder motion like?
that. And then we'll do
Good.
straight leg.
No restrictions before this,
I should
right?
probably go in order
For
for
my
you
shoulder?
though. Oh yeah, they're bending. We're not gonna do
For my
bending
shoulder
yet
when I was
though.
young.
We can do the very last
know.
one.
But
They never, you know, baby,
So with the
they-
groin
they-
stretch,
they-
sometimes this gets to be hard with just one
Wasn't no
person.
therapy, wasn't none of that. When I put my shoulder now
Hopefully it'll
16.
feel stretch.
well, the thing is,
we're gonna
like,
take this
if you
leg
have a
just
little
out
bit
to
of
the
a,
side.
you know, a little less motion in the
Should
shoulder,
fall off.
that's all fine and good. But then you hurt your elbow,
I'm
which
gonna make it so your kneecap is
further
facing up.
restricts this motion. Guess what? Your shoulder can't compensate for
We're
that.
gonna pull.
I ain't been
But I'm
feeling
not
it.
sure you're gonna feel. Did you feel a groin stretch at all on the left?
That pain is mostly.
Persevere.
So it's just literally, as he gets tight, you might want to bend and turn his leg out. You're gonna, what? You don't want him to do it. So you want the knee facing up, you want the knee to be straight, and you want to pull out. Okay? And that's just his way of one of the muscles. Like, oh, I don't really like that. But it's a little bit more common this way. So you just want the knee facing up and the knee pulling straight. Smiley to the side. Sometimes if you have a bed or a way to drop that one off to the side, kind of because what happens is if I pull far enough, that other leg just wants to come with me, and it's just not getting the stretch anymore. So sometimes finding a way to try to block it, someone holding it.
I think that's what he was doing. He was kind of pushing against this
Yes,
side.
I just don't have the long as arms as Dave, but a lot of times with my kids, that's what I'll do. But sometimes then I can't block. That's when it gets to be hard when you start getting tight, is you don't have enough arms to block all the cheats, I guess, your body wants to do. So having a second person, a lot of times it's helpful to make sure that leg does what it's supposed to do. All right, I'm gonna let her do it now. All right, your turn for that side. So on this one, this leg has to stay straight. I'm sure Dane's done this one. Now for you, finding position that's lower is gonna help your back because as you're lifting up, if you're, it's easier the higher you go. So sometimes I'll use my shoulder and stuff like that. But so you just wanna make sure as he gets tight, his knee's gonna wanna pop up. So if you're doing this all by yourself, a really good sheet, as he gets tight, because you're not gonna be able to hold it.
Just like this.
And if you're up on a bed or
Try to start
whatever,
yourself completely
I'll
awake.
get up
You
on
can
the
have that
bed.
little staggered stance. Make sure this doesn't hurt your
So
shoulder.
he can't lift his leg. Sometimes it's not she's trying to. It's just how it feels. Yes, it's
Well,
just how
right,
it
you can
feels.
pull on you,
Feels
you
big.
can control.
So you're aiming for like a 60-degree angle. So if you're staying in the middle is about 45. You're angling for a little bit past that, and you're not going any farther, even if you
So you
can't,
can do a
during the
little pushing,
lengthening.
but also
And just trying to keep the knee straight. So as he goes along lengthening, it's going to be really hard for him to keep that knee straight. So you may just need to back it down and then straighten. And that's okay if you do that. But if this is the one, if you feel pins and needles, then you would back off and you would let it go a little bit and kind of hold it at a level where he's not feeling the needles. This way. I'll take this out now.
No, he doesn't.
Let's do that. I think they weren't favorable. They gave you a whip. So you might as well just try getting healthy.
He hasn't done your rotation. All right, so I'm not going to bend, just going to bend a little bit right now, okay? He hasn't really done these yet. I'm going to put my hand right here in your, I'm not on an incision, am I? I'm going to turn it out, and then I'm going to twist your foot in. Do you feel that stretch anywhere? Side of your knee?
Yes.
Okay, perfect, that's where it's supposed to be. So they did an IT band release on you, but this is also one of the things to get this tight. So this is the best position to kind of stretch his IT band in right now. Eventually we might be able to teach a different position, but to make it easier for your wife to stretch you, this is the easiest one for her. So all we're doing, we're not bending it as far as he can go.
Right.
Holding the hip, so like, because otherwise it just lifts.
Yeah.
Holding the hip, taking it about halfway, and then I'm literally just turning his toe in as I drop it down.
Okay.
And he doesn't twist a lot, his joint just doesn't allow him, but he's
I think
feeling
you're
it where
right.
he should
But
feel
he's not
it.
that great either.
And so I would just ask that he feels in the like
He's got a gun,
lateral side
but
of
he
his
always
knee,
fumbles.
lateral support of his quad muscle.
All right, we're gonna do an exercise where we're laying on the
And you
back
might
here.
not, with time, he might not be able to tolerate as much
Maybe a little
flexion,
weight.
or if he doesn't for some reason.
I get that a lot, just naturally.
Yep. It's just some of our hips the way we're made. We're
Because we've been working on
but if
pulling up the blood.
he doesn't have it now, he may get it as he starts.
So again, if that's too far out, you can get a little closer if you want
Is
it.
you okay? This really is amazing. The fact that you're bending
So
your
I'd
knee
love
this
to try
far.
to get 10 each direction. But that's
impressive.
tough.
Yeah, they're doing your
Yeah, I
job.
think they're gonna just, just feel some things and get back to work. But steadily just get itself.
How big of a stretch?
Should I go for all 10?
What?
We're almost here.
So at the very beginning, warming them up. So you kind of you start like at a medium one, like okay, not too bad. I feel some stretching. I have kids who don't tolerate it very well. We can spend a half hour on bending, we'll spend a half hour to get to the point, and it's slow. So usually if you do it kind of really gradually,
Hop back hop.
then they'll tolerate it. Yeah, you're starting to feel it there. Twitching.
He said I can usually feel it when you start.
Yeah, you can feel it.
Glides, glides, that kind of stuff.
Thank you.
I got my hands on you.
Like if you have water, I'm gonna start pushing my hurt.
You're taking time, these things take time, but you're doing better all the time.
One that might be good to do on the kitchen table, if you have a stable kitchen table that's
Right.
sitting on the end, will not make it. So you're just gonna come down. Okay, and when you're ready, lean back. To do it by yourself, go ahead and bend your right knee if you need to. If you can use your body, let this knee down. Do you feel the hip stretch through here? So this is kind of how, if I have to do things by myself, and he's pretty flexible. If it's too much of a bend, like you can always
Just
change
move
the
it.
angle of the bend. The hardest part is when he gets tight, he may want to start flopping out. Is not flopping him out, then you may need help.
Yeah.
So I tend to use my body to help if he can't help hold his leg.
Right.
I mean, he can also start helping. He can get a towel. Some patients will. You mind getting a towel out of there? Sorry for him. That if that's too hard for you, looping it underneath and he can grab it. So, yep. You help hold that knee if you need to. So I can kind of help hold here. You're doing that just so it doesn't bend too far, and you can push down this way.
Oh, that makes sense.
Are you able to, am I pushing too hard on your kneecap though?
No.
Do you feel a good stretch?
Yeah.
Okay. If he gets to a point, he is also, as he gets tight,
He's gonna go out.
he's gonna go out.
So then kind of stand on the outside and keep him
Push
straight.
it in with your body and then push down.
Okay.
So just all those, and just find, I don't know which way his cheeks are gonna go, so. I can also use my shoulder. I've just found as being a female, a lot of times with even with the kids, I have to use my body to help in all the spots.
That makes sense.
How big of a stretch is this?
Pretty big.
Okay, give you a break. You wanna switch, you want to switch the towel?
Just kind of slowly ease him down into it.
Yeah, it's hard, I think, if you're in the position to kind of, he may get flexible enough, he can just sit on the edge and hang. And if he hangs for like a minute, he's going to feel, do you feel a stretch right now? Yeah. I'm not even pushing on him.
Yeah.
So if you're ever not there, he could, if he needs
Do it
to,
himself.
do the stretch himself. Yeah. Because I'm tight enough that I just sit on the edge and I feel a stretch. Do you feel it more in this position than on your stomach?
Yeah.
Okay. These, if I'd say for you, like you guys, the most important stretch is this one. The more you can do this one, the better. So I'm gonna just go ahead and scoot all the way back. You'll move his pillows as he goes.